At 7:34 on Monday morning, the ground began shaking across western Colombia. Within moments, buildings were damaged or brought down. Frightened residents poured into the streets, and emergency calls began arriving from communities across several departments. The earthquake was felt hundreds of miles from its epicenter, reaching major cities, including Cali, Medellin, and Bogota, as well as neighboring countries. The Colombian Geological Service later confirmed a magnitude of 7.4. The agency described it as the largest magnitude earthquake recorded within Colombia during the 21st century. By the evening of August 10, a national briefing from Colombia's president confirmed 132 deaths, at least 700 injuries, and 188 people reported missing. The president also reported approximately 5,000 homes damaged or destroyed. 3 hospitals collapsed, 18 others affected, and 86 buildings brought down as rescue operations continued well into the night, and the toll was expected to continue rising. This was not the destruction of an entire country, and it was not the strongest earthquake in Colombia's history. But for the communities struck hardest, it became a devastating emergency, one that was still unfolding long after the first violent shaking stopped. According to the Colombian Geological Service, known as the SGC, the main earthquake occurred at 7:34:29 a.m. Colombia time on August 10. That corresponds to 12:34:29 p.m. Coordinated Universal Time. Its epicenter was near San José del Palmar, a municipality in the department of Chocó in western Colombia. After manually reviewing the data, the SGC placed the depth at approximately 96 kilometers, or about 60 miles. The United States Geological Survey reached a closely related but not identical solution. The USGS listed the event as magnitude 7.4 on the mole at a depth of 107 kilometers. Placed the epicenter at 4.903 degrees north and 76.189 degrees west, approximately 5 kilometers east of San José del Palmar. Small differences between the SGC and USGS not mean that one agency is necessarily wrong. Earthquake locations, depths, and magnitudes are calculated using different seismic networks, models, and data processing methods. The numbers are often revised as analysts receive additional waveforms and perform a manual review. That revision process was visible during the first hours of this disaster. Early SGC estimates placed the earthquake at magnitude 6.7 and then 6.6 with a depth near 96 kilometers. After more data were analyzed, the agency revised the magnitude upward to 7.4, while the depth remained near approximately 96 kilometers. The final number most widely used by both major agencies is therefore magnitude 7.4. The USGS specifically identifies its measurement as W, a form of moment magnitude. The SGC public summary lists the magnitude as 7.4, but does not clearly specify the magnitude scale in the same way. This earthquake originated at an intermediate depth beneath western Colombia. Its depth helps explain why shaking was reported across such a wide area, even though the most serious damage was concentrated in particular cities and vulnerable structures. The SGC received more than 12,000 felt reports from approximately 900 populated places. Residents reported shaking in Chocó, Valle del Cauca, Risaralda, Caldas, Quindío, Antioquia, and other parts of Colombia. The movement was also felt in Bogota, despite the capital being far from the epicentral area. Reports extended beyond Colombia's borders. Ecuador's Geophysical Institute recorded a maximum observed intensity of 4 on the EMS 98 scale in parts of Carchi, Imbabura, and Esmeraldas. Weaker shaking was reported in several other Ecuadorian provinces. Panama's Civil Protection Agency also monitored the event after residents felt it, while the SGC received reports from Venezuela. One important distinction is frequently lost in early news coverage. Earthquake magnitude and shaking intensity are not the same thing. Magnitude 7.4 describes the overall size of the earthquake and the energy released at its source. Intensity describes how strongly the ground moved and how much damage occurred at a particular location. The SGC reported a maximum observed intensity of 7 on the 12-level EMS 98 scale. It should not be described as 7 out of 10. And it is not another way of stating the earthquake's magnitude. At intensity 7, well-built structures may sustain moderate damage, while weaker or more vulnerable buildings can be damaged much more seriously. The regional tectonic setting also matters. Colombia lies in a complex zone where the Nazca Plate moves beneath the South American Plate. The SGC reported a predominantly strike-slip focal mechanism for this earthquake. Scientists can describe that movement and the broader subduction environment, but no official agency had conclusively assigned the earthquake to a specific named fault at the time of this report. The first casualty reports were fragmentary. Early in the day, local officials confirmed 18 deaths in Pereira and 2 in Manizales. Later updates raised the national toll to 29, then 47, and then far higher as information reached authorities from additional cities. Those earlier numbers were not necessarily false when first published. They were snapshots taken during a rapidly developing emergency. But they can no longer be presented as the latest total without a clear timestamp. By 5:30 p.m. local time, the Colombian Association of Capital Cities reported 132 confirmed deaths, more than 570 injured people, and 86 collapsed buildings. 5 departmental capitals, Pereira, Cali, Quibdó, Manizales, and Armenia, were placed on red alert. Pereira appeared to have suffered the highest confirmed death toll in that city-level report. The number there had risen from the initial 18 deaths to 60 by the association's later update. In Cali, the emergency continued to expand through the evening. The city's mayor confirmed at least 20 collapsed buildings, with 188 people missing and rescue crews working at multiple sites. Later that evening, President de la Espriella's national briefing raised the injury count to 700 and confirmed 5,000 homes damaged or destroyed. He also reported 3 hospitals collapsed and 18 others affected. These updated figures replaced the earlier association report of 570 injuries, illustrating how quickly the situation was evolving as local data reached national authorities. The responsible approach is to state the time and source of each figure and acknowledge that the full picture was still emerging. With 188 people still missing, the confirmed death toll of 132 was widely expected to rise as rescue teams continued working through the rubble. In Manizales, the confirmed death toll in the later capital city report rose to 4. Video verified by Reuters showed part of a cathedral tower collapsing during the earthquake. Other buildings and homes in the city were also reported damaged, forcing residents to remain outside while inspections continued. In Chocó, communications and access complicated the first assessment. At one stage, the departmental governor reported 12 deaths and 84 injuries. Quibdó was among the cities placed on red alert, and the Capital City Association later listed deaths there as well. These local figures must be treated carefully because department-wide and city-specific counts can overlap. One of the most severe local damage assessments came from El Cairo and Valle del Cauca. The departmental governor said approximately 80% of the municipality's buildings and homes had been destroyed or damaged. That is a grave local assessment, but it does not support claims that an entire Colombian city or the entire country was destroyed. The Colombian government's early national assessment, released around midday, counted 1,575 affected homes, 37 destroyed homes, and 61 collapsed buildings. It also listed damage involving 18 health facilities, 52 schools, 17 community centers, 18 roads, and 7 airports. Those numbers were preliminary. The later Capital City report raised the number of collapsed buildings to 86, while the evening report from Cali showed that damage to homes, schools, and hospitals was still being identified. Airports in several western cities temporarily suspended or restricted operations for structural inspections. Roads were affected by debris, rockfalls, or landslide risks, and emergency teams had to evaluate bridges and public buildings before allowing people to return. Localized power, water, and telecommunications interruptions were reported, especially in and around Cali. However, no official nationwide total was available for utility outages. The same limitation applied to displacement. Families were sheltering outside damaged buildings, but authorities had not yet published a consolidated national number for evacuees, homeless residents, or displaced households. That absence of a total is important. It would be misleading to turn photographs of crowded streets or temporary shelters into an unsupported national estimate. Each image may show a real human emergency, but it cannot by itself establish how many people were displaced across Colombia. President Abelardo de la Espriella declared a national emergency and said the government's first priority was rescuing people trapped beneath the rubble. Search teams, firefighters, police, military personnel, medical crews, and civilian volunteers were deployed across the affected region. In Cali and other cities, rescuers worked around unstable concrete, damaged walls, and interrupted streets. Reuters reported the rescue of a baby and her mother from rubble, one of several operations unfolding as families waited for information about missing relatives. Hospitals that remained operational faced an influx of injured patients at the same time that parts of the health system had themselves been damaged. In some areas, patients were moved outdoors or transferred while engineers inspected buildings for structural danger. Authorities also introduced security measures in several affected cities. Curfews were imposed in some locations amid concern about looting and the need to keep damaged districts accessible to rescue vehicles. Public events were postponed, and additional security personnel were sent to support local authorities. The United States announced financial assistance, while governments in Latin America and other international partners offered support. Those offers could help with emergency supplies and longer-term recovery, but the immediate rescue operation remained led by Colombian national and local authorities. The danger did not end with the main earthquake. In its first official press release, the SGC said 18 aftershocks had occurred by around noon, ranging from magnitude 1.4 to 4.8. Later media interviews citing the agency placed the total at least 21 as monitoring continued. The strongest widely reported aftershocks struck at approximately 8:18 a.m. local time, less than 1 hour after the main earthquake. The SGC measured it at magnitude 4.8 and a depth of 88 kilometers. The USGS listed the same event as magnitude 5.0 at a depth of approximately 98.5 kilometers. Once again, the difference reflects the independent analyses of two seismic agencies. It does not indicate two separate magnitude 5 earthquakes at the same moment. Aftershocks are expected following a major earthquake and can continue for days, weeks, or longer. Most are smaller than the main event, but even a moderate aftershock can bring down walls or buildings that were already weakened. The SGC warned that additional aftershocks were likely. It did not predict that a larger earthquake was about to occur. Scientists can estimate probabilities and identify active seismic zones, but they cannot state the exact time, place, and magnitude of a future earthquake. For residents in damaged areas, the practical advice remained clear. Avoid visibly weakened structures, follow evacuation orders, and rely on official emergency instructions rather than viral predictions circulating online. Because Colombia borders the Pacific Ocean, reports of a major earthquake can quickly trigger fears of a tsunami. In this case, Colombia's maritime authority, DIMAR, issued an official bulletin at 8:04 a.m. local time stating that the earthquake did not pose a tsunami threat to the Colombian coast. The event was inland and deep beneath the region rather than a shallow offshore rupture capable of significantly displacing the seafloor. No official tsunami warning was issued for Colombia as a result of this earthquake. The SGC also addressed speculation about the Puracé volcano. The agency explicitly stated that the San José del Palmar earthquake was not related to Puracé's volcanic activity. Claims that the earthquake activated the volcano are therefore contradicted by the responsible scientific authority. In Ecuador, the earthquake was widely felt but produced much lower observed intensities than in the hardest hit areas of Colombia. Ecuadorian authorities reported 6 affected homes in an early assessment with no confirmed earthquake deaths. Panama's Civil Protection Agency said the earthquake was felt and carried out monitoring, but its official notice reported no identified damage. Venezuela also felt the shaking, although no confirmed damage from this Colombian event had been established at the time of this report. No official evidence had confirmed deaths, collapsed buildings, or significant damage in Peru. Any headlines suggesting that this earthquake caused a massive building collapse in Peru should not be used without a direct, verifiable source connected to this specific event. The magnitude 7.4 earthquake was historic, but it was not the strongest earthquake ever recorded in Colombia. The SGC's precise statement is that it was the largest magnitude event recorded within Colombia during the 21st century. Earlier earthquakes were larger, including the Great 1906 Colombia-Ecuador earthquake, estimated at magnitude 8.8, and the 1979 Tumaco earthquake, commonly listed near magnitude 8.2. There is also no evidence that all of Colombia or an entire major city was left in ruins. Some neighborhoods and smaller municipalities suffered severe destruction, and individual buildings collapsed in several cities. That reality is serious enough without exaggerating the geographic scale. Claims of hundreds or thousands of confirmed deaths were also unsupported at the time of this report. The latest confirmed nationwide figure was 132 deaths, 700 injuries, and 188 missing, and authorities warned that the toll would likely rise as searches continued. The orange alert shown by the USGS PAGR system should not be treated as an observed casualty count. PAGR is a rapid model that estimates the probability of fatalities and economic losses using shaking population and building vulnerability data. It is valuable for emergency planning, but it does not replace confirmed reports from Colombian authorities. Social media footage presents another challenge. Videos of collapsing buildings may be genuine, reused from older disasters, or mislabeled with the wrong city. Unless the location, recording date, and connection to this earthquake can be verified, such footage should be treated as illustration requiring confirmation, not as proof of a new death toll or a destroyed landmark. Magnitude alone does not determine the outcome of an earthquake. Depth, distance, local soil, building design, construction quality, and population density all influence how much damage occurs. In western Colombia, the earthquake's energy reached multiple urban areas where older, informal, or structurally vulnerable buildings could not withstand the shaking as effectively as modern earthquake-resistant construction. Mountainous terrain added another layer of risk. Landslides, falling rocks, and damaged roads can isolate communities even when their buildings remain standing. In remote parts of Chocó, heavy vegetation, difficult access, and disrupted communications slowed the first assessments and made it harder to establish a complete picture. The disaster, therefore, cannot be explained by a magnitude number alone. It resulted from the interaction between a powerful natural event and the human environment above it. For rescue teams, the first hours were about survival. Locating people, stabilizing dangerous structures, treating the injured, and restoring access to isolated communities. The next phase will be longer. Engineers must determine which homes, hospitals, schools, bridges, and public buildings can still be used. Families who cannot return home will need shelter and financial support. Damaged water, electricity, transportation, and communication systems must be repaired. Local governments will also have to decide where reconstruction is safe and how new buildings can better resist future earthquakes. The numbers in this report remain provisional. The confirmed death toll may rise as searches continue, while injury and damage totals will change as local records are reconciled with the national system. What should not change is the standard used to report the disaster. Every casualty figure needs a source and a timestamp. Magnitude must not be confused with local intensity. Computer models must not be presented as observed deaths. And images from social media must not be treated as evidence until their location and date have been verified. As of the evening of August 10, the president's national briefing confirmed 132 deaths, at least 700 injuries, 188 people missing, and 5,000 homes damaged. With rescue teams still working through rubble in Cali, Pereira, and other cities, authorities warned that the final toll would almost certainly be higher. Behind each changing number is a family waiting for news, a damaged community assessing what remains, and a rescue team still searching for survivors. The magnitude 7.4 earthquake lasted only moments. Colombia's rescue, recovery, and rebuilding will take far longer.